All right, everyone. Today we're tackling a topic that might seem pretty simple, but it's actually really important. Who should stay away from ginger, and what health condition make it a definite no-no? I'm willing to bet a lot of you have heard about, or maybe even experienced firsthand, just how amazing ginger can be for your health. We tend to think of it as this incredible gift, almost like a natural miracle cure. But let's be real here. Life isn't always easy. And using ginger without really thinking about it, or at the wrong time, can lead to some problems, side effects you weren't expecting, and it can even mess with your health without you even realizing it. Ginger really is a gift from nature, packing a serious punch with tons of amazing benefits for our bodies. It keeps our digestive system running like a well-oiled machine, calms nausea like a charm, loads us up with a good dose of antioxidants, and has antibacterial powers that help us fight off those pesky illnesses. But life sometimes throws us curveballs, and sometimes we need to slow down and really think about our choices before we reach for the ginger. In today's video, I'm going to break it all down for you, going over 8 specific health issues that you absolutely need to know about when you're thinking about using ginger, or maybe even deciding to skip it altogether. First off, anyone dealing with blood-related problems, especially uncontrolled bleeding disorders, should avoid ginger like the plague. For instance, if you're someone who gets nosebleeds out of nowhere, or you bruise super easily from even the smallest bump, you really need to cut back on ginger as much as possible, or just completely avoid any foods or drinks that contain it. The reason for this is that ginger contains compounds that can naturally thin your blood. So for people who already have bleeding disorders, ginger can seriously cause problems, making their condition even worse and increasing the risk of bleeding that they just can't stop. Ginger, with all its fantastic benefits, has become a popular choice for treating a wide range of issues. But because of its blood-thinning properties, we need to be extra careful when we're using it in situations where blood issues are involved. Active compounds, like gingerol and salicylates in ginger, can interfere with platelet aggregation and prevent blood from clotting the way it's supposed to. This means they can unintentionally disrupt the natural clotting process, which is a super important defense mechanism for our bodies. So people with a history of bleeding disorders need to be extra careful, because using ginger can raise the risk of bleeding that's difficult to control, potentially putting them in some pretty dangerous situations. If you're still hoping to enjoy the benefits of ginger in your daily diet, or as a way to help with treatment, definitely talk to your doctor for specific and accurate advice tailored to your specific situation. Secondly, people who are battling diabetes also need to tread carefully with ginger. Ginger has properties that can lower blood sugar levels, which can be a good thing for some people. However, if you're already taking medication or insulin to keep your blood sugar in check, using ginger can backfire, causing your blood sugar to drop way too low, which leads to a dangerous condition called hypoglycemia. Hypoglycemia is something nobody wants to experience. It can cause all sorts of nasty symptoms, like dizziness, feeling lightheaded, weakness, and even passing out, which can be a really scary situation. So people with diabetes should keep a close eye on their blood sugar levels when they're using ginger to make sure they're staying safe. Plus, like I mentioned earlier, ginger thins the blood, which can be helpful for people with normal blood clotting function. But for diabetic patients, blood clotting function might already be compromised, and ginger can make that even worse, like adding fuel to the fire. Also, some diabetic patients might experience digestive problems when they use ginger. Ginger can speed up the digestive system, which can make it tougher to control blood sugar levels, making treatment way more complicated. Thirdly, people with cardiovascular diseases also need to pay close attention to how ginger affects them. Using ginger should be something you really think about because it can have some negative effects on your heart health. This is mainly due to what ginger does to your blood and blood pressure. Ginger can increase blood circulation, which can sometimes cause your heart rate to go up, especially if you have a history of heart disease. On top of that, ginger also has blood-thinning properties, which can mess with the body's natural ability to clot blood. For some people, ginger can offer certain benefits, but for patients who are already taking blood-thinning medication, using ginger can be seriously harmful because it can thin the blood too much, leading to dangerous, potentially life-threatening complications. Fourthly, people with gallbladder problems should also be extra careful when they're using ginger. When your gallbladder isn't functioning the way it should, it has a tough time producing bile. Bile is a fluid that's super important for digesting food, especially fats. Ginger, which stimulates the gallbladder, can make problems worse for people with gallbladder disease, making the condition harder to manage. Also, gallbladder problems can sometimes lead to bleeding disorders, creating a vicious cycle of illness. Ginger, with its awesome anti-inflammatory and antioxidant properties, can certainly give you some health benefits. But if you're dealing with gallbladder issues, chat with your doctor for specific advice and guidance before you decide to use ginger. Instead of ginger, you could try chamomile or peppermint tea, as they might offer some benefits for gallbladder problems, helping you feel more comfortable. Fifthly, people who are thin or underweight should also be cautious when using ginger. Ginger, with all its amazing perks in helping digestion, reducing nausea, and effectively fighting inflammation, has become a familiar friend for lots of people. But for people with low body weight, ginger can cause some problems you don't want. It gets those digestive enzymes going, speeding up metabolism, which makes the body burn calories faster. This can lead to less absorption of some important nutrients, which can hurt the health of thin people, making them weaker. Plus, ginger also reduces appetite, making you eat less, which means you take in fewer calories. This is definitely not helpful for those who are trying to gain weight, making their goal even harder. So if you're trying to put on weight, talk to your doctor or a nutritionist for advice on a diet that's right for you to help you reach your goals safely and effectively. Sixthly, using ginger with certain medications can cause side effects you don't want, and it can even hurt your health. In particular, people who are taking blood-thinning medication for high blood pressure, or medication for diabetes need to be super careful because ginger can mess with these medications, changing how they work or causing bad reactions. Like I said before, ginger can thin the blood, lower blood pressure, and lower blood sugar levels. So using ginger with these medications can have negative effects, especially if you're taking warfarin or aspirin, which are blood-thinning medications. It's best to cut back on or completely avoid using ginger when you're taking these medications to avoid the risk of bleeding too much, which can be life-threatening. Seventh, people with a history of low blood pressure should also be cautious when using ginger. Gingerol, a valuable compound found in ginger, can lower blood pressure. It can also widen blood vessels, which leads to a drop in blood pressure. So for people who already have low blood pressure, using ginger can lower it too much, causing symptoms like dizziness, feeling lightheaded, fatigue, and even fainting, which can really mess with their quality of life. Plus, ginger can also increase the production of certain hormones, which can raise the risk of low blood pressure. So if you often have low blood pressure, use ginger with caution and always listen to your body. Eighth, and finally, You should avoid using ginger before and after surgery. When you're getting ready for surgery, your doctor will usually ask you to stay away from certain foods to avoid any problems that might happen during the procedure. Using ginger can raise the risk of bleeding during surgery because it thins the blood. This can make it hard to control the bleeding and increase the risk of complications after surgery, which can affect how well you recover. Also, ginger can lower blood sugar levels, which can cause problems for those who use insulin. And when you're having surgery, blood sugar levels that are all over the place can negatively affect your recovery. So doctors often recommend that you stop using ginger at least a week before surgery to make sure the surgery is safe and you recover well afterward. Ginger, with all its undeniable health benefits, can still be harmful to people with certain health issues. So, always be careful when you're using ginger. And don't hesitate to talk to your doctor for specific advice and guidance to help you use ginger safely and effectively. Thanks for taking the time to watch the video all the way to the end. If you found this video helpful, don't forget to smash that like button and share it with your friends and family. If this is your first time checking out our channel, hit that subscribe button so you don't miss out on more exciting and useful videos. Goodbye, and I'll see you in the next videos.